It has become standard practice for American households to substitute generic drugs for their name brand equivalents. However, a new class of drugs is emerging that attempts to emulate the efficacy of more complex drugs known as biologics. These biosimilar compounds attempt to emulate the efficacy of their biologic counterparts at a more reasonable asking price. A biologic is any medicinal product that is synthesized using living cells that have been grown in a lab rather than through chemical processes. This class of drug is relatively new, but has become very popular and so far has accounted for a quarter of America's total expenditure on prescription drugs in 2011, according to the IMS Institute.
In the world, more than 1 million patients will walk out of their doctor's office with a diagnosis of breast cancer. And about 25% of those patients will carry that specific protein which we talked, HER2 protein. And if somebody has HER2 so-called overexpression that makes that tumor more aggressive, the chance of dying from breast cancer substantially increases. And fortunately, still it's not good, but about 40,000 women will die from breast cancer in the US, and about 500,000 women will die from breast cancer all over the world. The number is decreasing here in the Western world, and a steady decrease in mortality, about 30% decrease in mortality over the past 10 years. That's because we have highly effective drugs, such as trastuzumab, to treat highly aggressive tumors. So that's a classical example of a biological agent which changed the natural history of a very aggressive breast cancer.
Biologics differ greatly from chemical drugs. They are extremely complex and consist of numerous active compounds. The number of proteins found within a biologic can be up to 10,000 times the size of chemicals in a standard drug. They are also extremely sensitive, and any change in the construction of these compounds can lead to unforeseen health complications. Due to the complexity of biologics, the manufacturers are unable to guarantee that these biosimilar medications can recreate their target drug with 100% accuracy. Although they are unable to perfectly reproduce a generic version of a biologic, these manufacturers can come close.
So if you look at overall cancer medicines, about 55% of the expenditure actually come from so-called biological drugs. Let's just say it's about $3,000 for one treatment for trastuzumab, and the patient may end up getting that for a whole year. So we are talking about a substantial, up to $50,000 worth of treatment for a year. And you have to translate that to low-income countries or even here. So I don't think in a global sense a global community can have access to such an expensive drug. So biosimilars, drugs with a similar activity, similar efficacy, if we can produce that in a less expensive way and provide that to patients in a less expensive way, that will increase access to this highly effective drug and potentially continue to improve survival in patients who can't afford to have this drug.